A new health center is being built on Eastern Michigan University's campus thanks to a unique arrangement between the Ypsilanti campus, nearby St. Joseph Mercy Ann Arbor, and IHA. Set to open in summer of 2019, the planned primary and urgent care facility is expected to benefit not only the university, but our community as well. So let's meet our guests.
I'm Jim Smith, the president of Eastern Michigan University.
Dave Brooks, I'm the president at St. Joe Mercy Ann Arbor.
I'm Mark LePage, the CEO of IHA.
And this is phenomenal to have all three of you in studio representing your various entities, because this is a fabulous partnership. And just to set the scene for everyone, tell us about your respective institutions. We'll start with IHA. Dr. LePage, many people may not realize its connection to St. Joe's and exactly how it was formed as well.
Sure, certainly. Thank you, Lucy. IHA is one of the largest multi-specialty groups in our region. We have 670 providers, licensed professionals, both physicians and physician assistants and nurse practitioners. We have been around for 24 years now, coming up on our 25th anniversary next February. We are, as you note, part of the St. Joseph Mercy Health System, and collectively we partner as part of the Trinity Health System, which is a larger health system. We really started out as a primary care organization back in 1994 with our founding CEO, Bill Folletti, pulled together a number of primary care groups originally. But since that time, we've grown pretty quickly and expanded our geographic reach into multiple counties in the southeastern Michigan region. And we've also expanded the depth of our services into multiple specialties beyond our primary care base.
In fact, you're one of the largest, aren't you, of multi-specialty areas doing this kind of work?
We are one of the largest multi-specialty groups in the region.
And again, a subsidiary of St. Joseph Mercy Health System as well. We were just talking about Bill Folletti earlier this morning, his wife receiving the Power of the Purse
indeed.
Award this week as well. Right. Yeah, United Way of Washtenaw County. So again, they were a dynamic couple, and it's nice to see her still involved in the community following his passing. St. Joseph Mercy Health System, David Brooks, tell everyone about this, because, again, we know of it locally through our Ann Arbor St. Joe's and, of course, Chelsea, which you acquired as well. But tell everyone a little bit more about the bigger entity.
Yeah, locally we think of the Ann Arbor campus and the hospital and all the other services there. But, we're a lot of reach, as Dr. LePage mentioned, through the Trinity system. So we've got 4 other hospitals in southeast Michigan, in Pontiac, Livonia, Chelsea, and also in Howell and Livingston County. A number of ambulatory, meaning outpatient facilities throughout the southeastern Michigan region. And then we're part of Trinity, which is one of the country's largest not-for-profit, Catholic faith-based health systems with almost 100 hospitals throughout the entire United States.
Wow. Yeah. Eastern Michigan University, of course, everyone knows the Eagles, founded in 1849, second oldest university in Michigan. And Dr. Smith, as president of Eastern Michigan University, tell us how all of this came about, this partnership to create a health center on campus.
Well, first I need to say, Lucy Ann, this is our birthday week, so we're 169 years old this week.
Wow.
Although I may look it, I am not 169. We've had a healthcare facility on campus for many, many years. It is an old healthcare style, and that style is certainly not what you see with the configuration we're looking at for our new healthcare center, which will work with our students, our faculty and staff, but also work with the community throughout. It's located near a bus line. It really is the openness of our campus represented in the healthcare arena, and it is something our students desperately wanted, needed, and are excited about. So this is a good thing for us.
What is everyone bringing to the party on this? Because each entity is doing different kinds of things to make this happen. So let's start with IHA.
Sure. We have the privilege really of bringing this new health center to life. This has been a wonderful relationship between Eastern Michigan University and St. Joseph Mercy Health System and IHA. And really, we're excited to bring the high-quality, patient-centered care that IHA is known for to specifically the campus of Eastern Michigan University, serving the faculty, students, and staff of Eastern Michigan University, but also serving the surrounding community. And just building on the principles that IHA has long established in terms of high-quality, patient-centered healthcare in our primary care practices. So that'll be part of that. And then in addition, we're going to have a 7-day-a-week urgent care center on that campus, which we're very excited about. And in fact, we bring some of the tools. We have a Save Your Spot tool for our urgent care. So if you want to get an urgent care appointment at any of our urgent cares in IHA, there's an app that you can use that will allow you to actually save your spot, similar to like you might use at the Secretary of State's office if you use that application at all. So we're really excited about bringing that to the table.
And Eastern Michigan University, you're going to be funding the construction of this?
We are using a third party to do the construction. We bring the land space, we bring the access to Huron River Road, which is important. But I think most critically, we bring the faculty, the students, and the staff who have the needs, and then also the community that we serve in many, many ways will now be served in the healthcare arena as well. We're also going to do the power, which we generate 96% of our own power now with our large-scale cogeneration turbine. So we'll be the power supplier for this facility as well.
That's amazing. I don't know how many people realize that happens on
It
campus.
is the most sophisticated turbine. This is not for this conversation, I know, but it's the most sophisticated turbine in the Midwest on a college campus with 20,000 students or more.
Wow. And you are building the roadway. You need to.
We're building a roadway. We'll build the parking lots. We'll do the landscape part of it. But the actual building of the facility will be done by a third party.
All right. And St. Joe's, talk a little bit about that.
Well, we're helping to kind of, we've been part of these partnerships now for a number of years with both organizations, of course. So I think we're helping to bring kind of all the parties together. We're going to have operational a pharmacy. We're going to have a lab so patients can have the convenience of staying within that health center for a lot of their ancillary work that their providers will need them to potentially have before their appointments or following up on their appointments. We're going to overall support. We're going to hopefully have a lot of wellness and prevention programs and other programs like that there too, as we kind of keep emphasizing overall health, not just always immediate medical care, but health of the population.
David, James, Mark, how did this start? How did this conversation start? Who brought it forward?
Well, St. Joe and Eastern, along with IHA, but particularly those two have been partners for many years on lots of different educational activities. IHA as well for some placements of physician assistants and other trainees. We started at, this is a good lesson, I think. We started a couple years ago institutionally at the beginning with St. Joe and Eastern Michigan, and starting to get together every 3-4 months as a leadership teams. It ended up probably 20, 25 of us between the two organizations saying, hey, we're already partners. But we've done it in little compartments. So let's step back, and we inventoried and realized we probably have 15 to 20 programs to varying degrees that we already work on together. So we talked about, of those programs, which ones can we do even more with? So how do we expand them? And then what programs are there that we're not doing together that we should be? So that just started to build trust and relationship and focus. And after 2 or 3 of those meetings, I think it just came up as, well, wait a minute, we, along with IHA, have this wonderful healthcare provider system, and you have a need in the sense of your student health services that you were looking to kind of improve overall the performance of them. And it just seemed like, well, why don't we work to both of our strengths? And IHA was right there at the, having not, I'd argue, not even just one of the best medical groups in the state, frankly, in the country, if you look at the outcome statistics for IHA as a physician and a provider group. So it was a perfect match.
I don't want to gloss over that point. Can you expand on that?
Sure, I can. So if you look, we always benchmark ourselves at IHA, and so and in fact the health plans that we work with. So Blue Cross Blue Shield, obviously a large institution here in the state of Michigan, in both their what they call their Blue Care Network program as well as in their traditional PPO programs, they have IHA ranked as number 1 or number 2 among medical groups in terms of quality in the state.
Mm-hmm. Oh, that's tremendous. This is going to go on the northwest corner of campus at Eastern Michigan University. It's fairly close to St. Joe's as well. Right. David had mentioned, James, that you've had these partnerships already going on via classwork and the kinds of things that happen on campus. And I guess, again, I hadn't realized the extent of that partnership.
It's a massive undertaking, and David was in his role about a year prior to my coming, and we realized that we had so many collaborative activities. For example, our simulation lab that rests on David's campus our physician assistant students are there. It seems like all the time. That's probably a little bit of an overgeneralization, but our RN students are there. Dave and I were having lunch one day in the cafeteria, and I said, "Who are all these high school kids that are behind me?" And David said, "Jim, those are all your RN students."
We felt very old.
But it just, I think, really dawned on us that we have PA students, we have clinical psych students, we have RN students, we really have occupational therapy. We really have a wonderful set of opportunities for our students to work with St. Joe's, but also to work with IHA as preceptors and other opportunities that we just thought this was too good of a deal not to do.
Had you been thinking for a while that you needed a new health center?
Well, our students have been thinking for about 15 years. I've only heard it for about 2.
You've only been there 2 years.
Right. Snow Health is an old facility, and no matter what we did, even if we said, okay, we're going to bring IHA physicians in and we're going to bring mid-level providers in, it still wouldn't have been the right facility. So it immediately said, no matter what we do, we have to talk about a new facility. And that's what really got the three of us going was, where would it be? How would we serve Ypsilanti, which I didn't know until I started working with these two gentlemen, is an underprovided primary care community. Mm-hmm. So we now are putting a primary care facility right in their backyard, again, on a bus line where anybody can get there. As Mark said, I did this for my wife a couple weeks ago. She had a sore throat, and I said, hey, I know how to get you a spot in one of the, it was a Sunday. I can get you one of the spots at one of the quick care clinics, and we did that. We reserved our spot, and we were there.
Right.
So these are things that our students are very interested in.
This marks the changing world of healthcare in a very profound way. When you look at these kinds of collaborations to make things happen, it takes money, it takes location, and there has to be a need out there, and it's got to be put in the right place. How unique is this, though? Is this being done in other communities across the nation?
Yeah, I'll jump in other, and Jim, especially from the educational kind of landscape. I mean, from a healthcare system landscape, there's certainly other health systems that work with local colleges and universities. I don't know necessarily to the extent of this kind of level of co-development. Mm-hmm. I think, frankly, in St. Joe's, especially since our campus is adjacent to parts of the Eastern Michigan campus, we certainly were already a provider to a lot of the stakeholders at Eastern Michigan, faculty and families and students and others. And they'd come over to the campus for various services. But to actually develop with, again, in this case with IHA as the great medical group, on-campus facilities to kind of co-run them in some ways. Eastern Michigan is going to also occupy a large part of this building for some educational programs, training programs that they offer for healthcare related professions. So I'm not aware of many like that around the country.
I'm not either, and I really think this is just this is the start. I think this is an opportunity to even build off of what we've done here collaboratively among the three institutions.
That's Dr. Mark LePage. He is the CEO of IHA, David Brooks, president of St. Joseph Mercy Ann Arbor, and Dr. James Smith, president of Eastern Michigan University, talking about this collaboration that is going to materialize in 2019 in our community right on the campus, Ypsilanti campus of Eastern Michigan University. It'll include comprehensive primary care services, 7-day-a-week urgent care services, including X-ray, electronic medical record capabilities, online appointment scheduling, the Save Your Spot tool to manage urgent care arrival and wait times. Boy, that's a lifesaver right there. And on-site pharmacy staffed by St. Joe's. And you have a vast array, Dr. Smith, of programs now in the healthcare field, but is this going to allow Eastern to add any kind of programs or degrees in the medical field?
It'll certainly help us grow the ones we have. That's one that we're very aware of. As we said earlier in the conversation, we will have some of that space for, we have a very extensive counseling services program. It'll allow for more internship opportunities. Whether we'll launch new ones or not probably is still out there in the future a little bit. We did talk about the unique nature of this. I'm really only aware of places that have done it with their own medical schools. So the medical school may spin off one if you're a large university with a comprehensive medical school. But I'm not familiar with a design like this anywhere. Certainly, I've been at 5 universities and not seen it any of the universities where I've been either a faculty member or administrator. So time will tell as to what those needs are and what we might be able to program in for those needs in a curricular way.
Interesting in these challenging health times that we have to see the expansion of many of these healthcare facilities and practices. Does St. Joe's have future plans of doing anything else? I mentioned you acquired Chelsea Hospital. What else is in the future for you?
Well, we're always growing. We're adding new services both at the the hospital campus in the sense of expanding services or adding new technology or new subspecialty capabilities. IHA is growing primary care and other medical centers throughout the community, opening up new locations, moving locations because they're out of space overall. And then, of course, we do this throughout not just in the Ann Arbor and the Washtenaw County community, but through the other communities that we serve too.
So how are you doing this in challenging times with funding? And maybe we can look at this, how this funding all came together as well for this 25,700 square foot facility. The construction costs of nearly $6.6 million funded through IHA and St. Joe's. Mentioned the road. The university is going to be putting in a little under $2 million for the road to go in there. Eastern will have half the facility, and IHA will be in about the other half there. Yes. So it's kind of what we're looking at on campus. But how did the money come together for this?
Well, we're not-for-profit organizations and community organizations, but we're large budgets. Let's face it. We understand that. So we're always reinvesting in ourselves and developing. Our focus over the last couple of years is to maximize how much of that reinvestment goes into the community. So not that we're not always adding some hospital services or technology and things like that. We're really conscious right now to prioritize as much as we can with clinical services, primary care, wellness, prevention in communities where people want to get their health care. So the Eastern example is, where students are living and going to school, where people work, Eastern faculty and Eastern staff, and then obviously the core IPSI community right there. So that's a priority. Again, IHA is doing this in mass right now with a number of new developments going on that are almost all primary care focused.
Right. So, and we have a broad primary care base. We're always expanding that, and we certainly also have the specialty component. But we're trying to, our purpose at IHA is to, as part of the St. Joseph Mercy Health System, is really to surround the patient, right? We want to be there for members of the community, our patients, as they need services, that we're there and available for them in a very friendly and welcoming kind of way. Mm-hmm. That's really what we're about.
And Dr. Smith, you had mentioned that Ypsilanti was underserved with primary care physicians, that this is going to help in that regard as well. And it's nice to see everything that's been going on, downtown Ypsilanti flourishing with the new businesses that are going in there, and the restaurants and the added attention to that community. It really no longer is just an offshoot of Ann Arbor. Ypsilanti is really coming into its own. And when you see these kinds of projects, that certainly goes a long way to help as well.
Well, that's certainly, we're very mindful of that, Lucianne, as we thought about how to do this, where to put it. We actually gave Dave Brooks several sites, and it took about 30 seconds for his team to say, this is the site we want, because it did have that availability to bus routes. It's close to their major campus, and it also just made sense for flow of our campus. How do we get students over there? What's the walkway look like? We'll do that with our capital budget, by the way. And we have a fairly large capital construction budget every year, and we will make that part of this, again, to meet student needs.
Excellent. And the Snow Health Center, what will become of it?
Well, that's the next architectural question. Is there a way to gut it and establish it as a new kind of building? Does it need to come down? Does it become green space? All of that we'll do after we launch in 2019. Because frankly, we'll be in it until the day we move over to the new facility. Then we'll get our architectural team and outside consultants to look at what's its viability, what's its life. It is a concrete load-bearing wall building. Oh. So you can't just take walls out because they hold the floor above them.
Right.
So we have to think about what would you do with space like that. And it's a very old building, not architecturally delightful.
Dr. LePage, what are you hearing from your medical staff in this development, and how are they reacting to this?
Oh, they're tremendously excited. I mean, I think all the time we already have a presence in that area, but, so we'll build on our existing practices and certainly the ability to then offer the same high-quality services that we've historically provided throughout IHA, specifically to the faculty, staff, and students of Eastern Michigan University and the surrounding community. Folks are very excited about it within IHA, and there's more folks for us to help take care of.
These really are exciting times, and the opportunities not only to the community and the students who will be served by the medical staff there, but also the students who will be able to learn and grow from this opportunity, right?
And we hope that our students also will, because many of our students stay, 77% of our students stay in the state of Michigan, but many of them stay in the Ypsilanti, Ann Arbor, Southeast Michigan area. They'll make a connection with a primary care physician that will be their primary care physician in their 20s and in their 30s and in their 40s. It is a pretty underrepresented group. I think some of the internal medicine docs are actually anxious to see this population because it's not a population that comes into hospitals or clinics very often. So we hope to build a relationship that will help them have lifetime really good health care.
Creating a healthier community, too,
Correct.
in the process.
And healthcare is growing through locally as well as through the country. We're going to need more and more professionals and caregivers. So this is a chance to kind of catch young people when they're making choices. Do I want, what are going to be my career aspirations? Do I want to go to healthcare? If I want to go into healthcare, which part of healthcare? Do I want, I want to be a caregiver? Do I want to be an administrator? Does anybody actually pick to be an administrator?
No.
Well, never mind. Do I want to be, a support service person in healthcare, IT, whatever it might be?
Right.
So this will be a chance to kind of hopefully expose them to high quality, high service, compassionate healthcare that hopefully will inspire maybe some of these kids to go that way versus a different route from a career perspective. And many of them may be caring for us, Dr. Smith, over the next 20 or 30 years as we need more and more health care ourselves.
I think, and that's really an important point. I mean, I think that's one of the advantages that partnering with Eastern really brings to us, because we're going to have we have a critical need for all sorts of professionals throughout the healthcare industry. And so how can we work with Eastern Michigan University to make sure that we've got people who are coming and taking care of us 20 years from now, right? And that's why this partnership is so exciting, I think, to Dave and myself, to say how do we staff the hospital, the clinics that we're taking care of going forward.
David, do you anticipate doing this on other campuses, i.e. University of Michigan?
Well, they seem to have their own healthcare educational system at the moment. We have, but we're working with them.
Is
We
it a
got
possibility?
we got lots of collaborative partnerships going with Michigan and St. Joe's right now, and more to come, including Chelsea, as you mentioned earlier. That's planned to be U of M and St. Joe's kind of combined facility over the next few months as that project moves forward.
Mm-hmm. And
there's other ways we work already with U of M, so I think we're looking to do that. I don't know if they're looking for St. Joe's to take over their on-campus delivery of health care. I think would entertain the chance to review that, but the phone hasn't rang yet for that one.
Isn't the key, though, collaboration? Anytime when you see growth and you see people being able to prosper and to elevate nonprofits and just the community in general, it certainly seems to happen a lot quicker when you're working together, like all of you are.
Absolutely.
Without a doubt.
I agree.
Yeah, and I think that's part of, again, what we found as we started to talk with Eastern about all the programs we do jointly. We didn't just look at the clinical and the healthcare educational component. We looked outward at all the community programs that the three organizations do together, and some of them we do separately. So, Eastern might have a community event working with some of the neighborhoods around the Eastern campus, and I think we identified, well, why can't St. Joe participate in that? You're out there doing that. Why don't we go with you? Mm-hmm. Or vice versa. We have on the St. Joe campus a working farm, which is pretty unique for a hospital, a healthcare organization to have. Eastern brings now, in the summer, some of the high school kids, disadvantaged youth high school kids, programs that you work with throughout the Metro Detroit area. And they come for, I think, a week of that program into the farm and do some work at the farm, learn about wellness, learn about healthy eating, change, hopefully maybe influence some of their behaviors. So we realize there's a lot of community things we're already doing together. IHA is a great participant in that United Way. We mentioned it earlier. Mm-hmm. All three organizations are big players in United Way.
Yeah. And I think it's Wednesdays when the fresh produce is.
We have the farmers market in the lobby of the hospital on Wednesdays.
Yeah.
And right now it's been winter. I learned more. I grew up in the city of Detroit. Like, I know anything about crops. But we've moved from radishes and kale, which are winter crops, and hopefully over the next month, assuming the weather cooperates, we'll start moving into the spring crops.
Yeah, I know a lot of people who go out there just to get that in the lobby there at St. Joe's. But my favorite part at St. Joe's? When I see a surgeon sit down and play the piano in the lobby.
Oh, in the lobby at
that's
our
my
piano.
absolute favorite
right?
part. You can always tell who they are.
We just don't want them ever to hurt their hands.
Yes, right. David Brooks, he is president of St. Joseph Mercy Ann Arbor, and Dr. Mark LePage, who is CEO of IHA, and Dr. Jim Smith, president at Eastern Michigan University. I would be remiss, Dr. Smith, if I didn't ask you about the big announcement yesterday. You're having to cancel sports at Eastern Michigan University. Scott Weatherby, your athletic director, he actually was crying during this, and he happens to be my neighbor, and I know what a wonderful man he is. I thought it was very poignant that he brought up that he also went through this when he was a student at Ferris State University, and the baseball program got cut there. So he knew what was about to happen with these young people and the coaches. I know it was a hard day for all of you.
It was a very difficult day, Lucianne, and I met with the students that were affected. 83 of them with Scott, 7:30 in the morning yesterday, and I have to tell you, I didn't sleep real well the night before, and about 4:30 in the morning, I was up kind of prepping what I was going to say. But as David said earlier, we have large budgets. But we have to focus our budgets. And we had 21 sports in the Mid-American Conference. We were the largest number of sport providers. We don't have the largest budget in the Mid-American Conference. So we're looking at how we shape our budget and do things that lead folks into healthcare, for example, or engineering. We can't be all things to everyone. And I believe Vice President Weatherby did a phenomenal job of looking at these, making a decision based on data, not on emotion. But clearly he was struck by emotion. One thing he said to me with the students in front of him yesterday morning was, I vowed that I'd never do this after it was done to me. Yeah. And he said, here I am 25 years later breaking my own personal vow. That's a person that's authentic, they're real. He had pain for every student in the room. And had there been another budgetary way, we certainly would have leaned that direction. State budgets are tight. We have to direct our budget to do the things that we know are the best for the future of all of our students on campus and for our faculty and our staff. We're rebuilding an engineering building for $40 million. We have to craft those dollars in certain ways. We're redoing a rec facility for $16 million because we think recreational health is important to all of our students. So it was a hard day. It'll continue to be a hard day.
Dr. Smith, there are some who are calling for perhaps the dismantling of the football program. That has been a theme on this community for the last few years. The program has been doing much better, but still has a long ways to go. You can't get rid of it and remain in the MAC.
That is correct.
So why is that important to remain in the MAC?
Well, I think it's our aspirational peers. That's not the only answer, Lucianne, but I like very much for our students to be referenced in sentences that, like Miami of Ohio, like Ohio University, like Central Michigan, like Western Michigan. Those are aspirational peers. Mm-hmm. There's also a misnomer, I believe, that everything that goes to football goes into a dark hole. We get dollars from ESPN1, ESPN2, ESPN3, and CBS Sports. It's one of the very few sports we have that have revenues that come in. When we play a university like Wisconsin, we'll play in a few years, there's a very large dollar outlay for us to go to Wisconsin and play. Should we become a Division II team, those would not be available to us. And there's also a penalty clause to leave the Mid-American Conference, and it's not a dollar and a quarter. So we would have to pay a very significant amount to leave the Mid-American Conference. So we've taken that. Certainly we've heard those voices. We've looked at those numbers, and I asked Vice President Weatherby to make that decision. I don't know enough about each of the individual sports other than to be helpful and give him the data that he asked for from our institutional research and our budget leadership team. But he did that work, and I'm proud of the kind of work he did.
In his emotional presentation, Scott Weatherby had mentioned that it was his estimation this should have been done a long time ago, that he stepped into this not realizing how bad it was. Should these cuts have been made under Heather Lake's administration?
Well, it's always easy to look. My grandfather used to say it's easy to drive. He owned a trucking company. It's easy to drive a truck looking in the rearview mirror. And that was a joke. It's not easy to do that. But yes, I think we should have done it earlier. Did we have a little better budgetary lift 4 years ago? We did. Was our state appropriation a little better 4 years ago? Did students take more credit hours 4 years ago? So I think Scott's correct. We should have done it, whether it's 4 years or 7 years ago. It's been quite a number of years since we've eliminated a sport. When Buffalo, which is a very good mirror partner of ours, eliminated sports just about a year before us, or 11 months before us. We knew that was the harbinger of things to come.
If student enrollment was up closer to what it had been a few years back, would that have mitigated this?
Well, the senior staff loves my line because I quote Dr. John Porter often. Dr. Porter said that the institution was never so strong with 25,000 students taking 15 credit hours each. We're not 25,000 and they're not taking 15,000 credit hours.
Yeah.
We're more at 20,000 and our average credit hour is about 12.
And why is that?
Well, students work today. They didn't work years ago. The high school graduation rate is much lower today. The birth rate in Michigan is lower. Dr. LePage grew up in the UP, and if you look at some counties in the UP, the birth rates are incredibly low. Oh, we recruit there. So we've gone to a global recruiting strategy. We're doing more in the international arena. We're doing more around the country. We have a big push now in Pennsylvania and Illinois. So we don't see this as darkness. You know, the tunnel is no light at the end. We see this as a restructuring, a going forward. And I do caution people, say it's always easy to look backwards and say, well, you should have done this, particularly when I wasn't here. It's unfair to the people that were here at that time.
You quoted Dr. Porter, the former president at Eastern
Yes.
Michigan years ago. I think of him a lot because he is entombed directly across from my mother and father at Washtenaw. So I'm there every week, and I say a little hello to him.
Please say hello for me as
I
well.
will do that.
Thank you.
Thank you so much. I appreciate you answering my questions on that.
My
As I
pleasure.
mentioned, I would have been remiss not bringing this up during this segment. Dr. James Smith, president at Eastern Michigan University, also with us today. We thank Dr. Mark LePage, who is CEO of IHA, and also David Brooks, the president at St. Joseph Mercy Ann Arbor. Eastern Michigan University, St. Joe's, and Integrated Healthcare Associates are collaborating on a new health center on the EMU campus. Plan approved by the Board of Regents last month. It'll be located on the northwest end of campus on open land off Huron River Drive and Oakwood Street, very close to the EMU Department of Public Safety. And it's going to be amazing to see this come to fruition. It's going to be something that everyone in our community will be able to take advantage of. And a big salute to all of you and your institutions. Thank you.
Thank you.
Thank you.
Lucy.
You're listening to the Lucy Ann Lance Show, Ann Arbor's talk station, 1290 WLBY.